Herniated Discs Unveiled, the epic guide to conquer back pain. Get ready to embark on an extraordinary adventure into the mysterious world of herniated discs. Hey there, welcome back to MindState. We're here to help you tap into your full potential and become the best version of yourself. In this video, we'll unravel the secrets of this common yet enigmatic condition that causes back pain. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What is a herniated disc? Unveiling the mystery. The spine, also called the backbone, is a vital and intricate part of our bodies. It consists of stacked bones called vertebrae, separated by small, rubbery discs known as intervertebral discs. These discs act as cushions, protecting the spine and allowing for smooth movement. Sometimes, however, these discs can experience issues. One common problem is a tear in the outer layer of the disc, called the annulus fibrosus, which can lead to a condition known as a herniated disc or slipped disc. This occurs when the gel-like center of the disc, called the nucleus pulposus, protrudes through the tear and puts pressure on nearby nerves. Symptoms of a herniated disc can include pain, numbness, tingling sensations, or weakness in the affected area. For instance, a herniated disc in the lower back can cause discomfort in the lower back, buttocks, thighs, or calves, while one in the neck can result in neck pain, shoulder pain, or tingling sensations in the arms or hands. It's important to remember that not all herniated discs cause symptoms, and the severity of symptoms can vary. Unraveling the causes. Who's at risk? As we carry out our daily activities, our spine is exposed to various stressors. Improper lifting techniques like bending the back or twisting while lifting heavy objects strain the discs in our spine. This increases the risk of tears and herniation. Learning and practicing proper lifting techniques, such as bending the knees and maintaining a straight back, can help minimize the chances of a herniated disc. Awkward movements can also contribute to herniated discs. Forceful twisting or bending motions, especially when combined with heavy lifting or carrying, put excessive pressure on the intervertebral discs. Although these discs are designed to handle a certain level of stress, repetitive or sudden movements can surpass their capacity, leading to tears and herniation. Genetics play a role in our susceptibility to herniated discs. Some individuals may inherit specific traits or structural variations in their spinal discs that make them more prone to herniation. While we can't change our genetic makeup, understanding this connection can help us take extra precautions and be mindful of our movements to protect our spine. Occupational factors can also contribute to herniated discs. Jobs that involve repetitive movements, prolonged sitting or standing, heavy lifting, or constant vibration put significant stress on the spine. People in physically demanding professions, such as construction workers or nurses, may face a higher risk of herniated discs due to the demands on their backs. Prioritizing ergonomics, taking regular breaks, and practicing exercises to strengthen the back can reduce the risk of herniation. Weight management is another crucial aspect to consider. Excess weight places additional strain on the spine and accelerates disc degeneration. The increased pressure on the discs makes them more susceptible to tears and herniation. Maintaining a healthy weight through a balanced diet and regular exercise helps alleviate stress on the spine, reducing the risk of herniated discs. Surprisingly, smoking can impact the health of our spinal discs. Smoking restricts blood flow to the spinal discs, depriving them of essential nutrients and oxygen. This impairs their ability to heal and regenerate, making them more vulnerable to injuries and degeneration. Quitting smoking not only benefits overall health, but also improves the condition of spinal discs. Decoding the symptoms, pain's secret language. Herniated discs can have different effects on individuals, with some people experiencing no symptoms at all. However, many others face classic symptoms like shooting pain, tingling, and numbness. The location of the herniation in the spine influences the specific symptoms a person may feel. On the other hand, many people do encounter symptoms that can greatly impact their daily lives. One common symptom is shooting pain, which is a sharp and intense sensation that radiates from the affected area. This pain can travel down the arms or legs, feeling like an electric shock or a sudden jolt. It can cause discomfort and sometimes even limit movement. tingling and numbness are also prevalent symptoms associated with herniated discs. You may experience a sensation of pins and needles, or a feeling of numbness in specific areas supplied by the affected nerves. For example, if the herniation is in the lower back, you might feel tingling or numbness in your buttocks, thighs, or calves. Similarly, a herniated disc in the neck region can lead to tingling or numbness in your neck, shoulders, arms, or hands. These sensations can come and go or persist depending on the severity of the herniation and nerve compression. The location of the herniation in the spine plays a significant role in determining the specific symptoms experienced. Different regions of the spine result in distinct sensations in affected areas. A herniated disc in the lumbar spine, lower back, can cause symptoms that radiate down the legs, known as sciatica. This can lead to pain, tingling, or numbness in the buttocks, thighs, or even down to the toes. Conversely, a herniated disc in the cervical spine, neck region, can cause symptoms like neck pain, shoulder pain, and radiating discomfort down the arms and into the hands. This condition is called cervical radiculopathy and can result in tingling, numbness, or weakness in the affected areas. Cracking the diagnosis code, tests, and examinations. When it comes to diagnosing a herniated disc, doctors employ various approaches to gather information and reach an accurate conclusion. The process typically begins with a thorough physical examination. During this examination, the doctor will carefully assess your medical history, paying close attention to any symptoms you may be experiencing, and conducting a comprehensive evaluation of your spine's range of motion, reflexes, and strength. This initial examination provides valuable clues to help guide further diagnostic steps. In addition to the physical examination, doctors often utilize imaging tests to obtain a detailed view of the spine and identify any abnormalities. X-rays are a common starting point, as they can provide a basic overview of the bones in your spine. Although X-rays do not directly show the intervertebral discs, they can help rule out other conditions and detect certain signs associated with a herniated disc, such as bone spurs or changes in spinal alignment. For a more detailed assessment, doctors may recommend a CT scan, computed tomography, or an MRI, magnetic resonance imaging. These imaging techniques allow for a comprehensive visualization of the spinal structures, including the intervertebral discs. CT scans provide a cross-sectional view of the spine, offering precise details of the bones, discs, and surrounding tissues. On the other hand, MRIs use powerful magnets and radio waves to generate highly detailed images of the spine's soft tissues, providing a closer look at the intervertebral discs, nerves, and surrounding structures. These advanced imaging tests help doctors accurately diagnose a herniated disc and assess its location, size, and impact on nearby nerves. In some cases, doctors may utilize nerve tests to further evaluate the extent of nerve involvement. These tests, such as electromyography, EMG, or nerve conduction studies, measure the electrical activity in your muscles and nerves. By assessing the response of your nerves to electrical stimulation, these tests can help identify specific areas of nerve compression and determine the severity of nerve damage. Nerve tests are particularly useful in situations where symptoms are complex or when surgical intervention is being considered. Combating the discomfort, effective treatment options. In managing the discomfort caused by a herniated disc, various strategies are available. These include pain-relieving medications, injections, physical therapy, and, in rare cases, surgery. Medications like NSAIDs can help reduce pain and swelling, while corticosteroid injections target inflammation. Physical therapy aims to strengthen muscles, improve flexibility, and promote healing. Surgery is considered when conservative treatments fail to provide relief. It's important to consult with a healthcare professional to determine the best approach for your specific situation. Most individuals find relief and regain an active, pain-free life with the right treatment. You've just unlocked the secret knowledge of herniated discs, becoming a true expert in the process. Now armed with a superhero's arsenal of information about causes, symptoms, diagnosis, and treatment options, you're ready to take charge and conquer any challenges that come your way. So buckle up, my friend, because you've become a force to be reckoned with in the battle against back pain. Remember, with the power of knowledge and open communication with your doctor, you'll soar through life with a spine that's as strong as steel. Get ready to embrace a pain-free and empowered future. You've got this. Thanks for watching, MindState fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.